As cases of COVID-19 skyrocket across Latin America, frontline defenders at this hospital in Valparaíso, Chile, are struggling to save lives. Chile has one of the world's highest rates of COVID-19 infections per capita.
Although Chile has a good health system, it wasn't prepared for the pandemic. The first measures that were taken at the beginning of this were not the most successful possible.
Dr. Zuniaga is recovering from COVID-19 himself. He says the lockdown Chile implemented early on did not work. Like many Latin American countries, Chile struggles with a high rate of poverty, densely populated areas, and a massive off-the-books workforce. For many people in those conditions, stay-at-home orders are impractical. More than 2.5 million COVID-19 cases have been reported in Latin America, pushing overstressed healthcare systems to the limit. Epidemiologist Alejandro Rizquez says government inaction has exacerbated the situation in the worst-hit Latin American countries.
Some countries closed their borders and prepared their citizens as soon as they got their first cases. Other countries were less strict, and now they're suffering the consequences of those decisions.
The numbers of deaths in Mexico, Peru, and Brazil have been doubling every 3 weeks. Mexico's president suggested a clean conscience could help fight COVID-19. Brazil's president called it a measly flu. In recent weeks, Brazil has often recorded the highest number of new infections and daily deaths in the world. All the governments in Latin America have been weighing dueling demands. How do they limit the spread of the virus and at the same time keep the economy open? After nationwide lockdowns were put in place, the IMF predicted a 9.4% recession this year for Latin America and the Caribbean. At this food market in Caracas, Venezuelans are paying attention to social distancing and sanitary precautions. But people here are worried if they stay at home, they will starve.
We can't be at home forever. We're leaving the house because we have to buy food, to live, to work, looking for a way to survive.
So far, Venezuela has one of the lowest rates of COVID-19 cases in Latin America. But many migrants who left Venezuela for Colombia in recent years are now crossing back to Venezuela, where relatives may take them in, but work is hard to find.
Latin America is a continent where the majority of the jobs are in the informal sector, mostly menial work, and it is not easy for these people to face unemployment.
Not easy to face unemployment or the long days locked inside, as Latin Americans, like people worldwide, look for some light at the end of the tunnel as they struggle to keep themselves and their families safe. Triny, Mena, SABC News, Caracas.